Okay, this is the ATI Community Chapter 1 Overview of Community Health Nursing. Community health nursing is a population-focused approach to planning, delivering, and evaluating nursing care. Community health nursing is a broad field that allows nurses to practice in a wide variety of settings. Community health nurses promote the health and welfare of clients across the lifespan and from diverse populations. Foundations of community health nursing. Concepts related to public health are evident throughout history as provisions were made to care for poor or displaced. Advances in knowledge about health led to appropriate education of providers and regulation of water and other environmental factors. The Public Health Service was developed in 1798, and nursing care in homes was implemented in the early 1800s. Later in the century, efforts began to establish local health boards to monitor disease, promote health, and collect statistics about the community. Multiple theories and specific definitions of care guide nursing practice in the community. Community health nursing theories. System thinking. Studies how an individual or unit interacts with other organizations or systems. Systems thinking is useful in examining cause and effect relationships. Upstream thinking is used to focus on interventions that promote health or prevent illness, as opposed to medical treatment models that focus on care after an individual becomes ill. Nursing theory provides the basis for care of the community and family. Theorists have developed sound principles to guide nurses in providing high-quality care. Examples of nursing theories appropriate for community health include the following. Nightingale's environmental theory highlights the relationship between an individual's environment and health, depicts health as a continuum, and emphasizes preventative care. The health belief model, purpose is to predict or explain health behaviors, assumes that preventative health actions are taken primarily for the purpose of avoiding disease, emphasizes change at the individual level. It describes the likelihood of taking an action to avoid disease based on the following: perceived susceptibility, seriousness, and threat of disease. Modifying factors such as demographics, knowledge level. Cues to action is media campaigns, disease effect on family and friends, recommendations from healthcare professionals, and perceived benefits minus perceived barriers to taking action. Milio's framework of prevention complements the health belief model, emphasizes change at the community level, identifies relationships between health deficits and availability of health-promoting resources, theorizes that behavior changes within a large number of people can ultimately lead to social change. Pinder's health promotion model is similar to the health belief model, does not consider health risk as a factor that provokes change, examines factors that affect individual actions to promote and protect health, personal factors such as biological and psychological, socioculture, behaviors, abilities, self-efficacy, feelings, benefits, barriers, and characteristics associated with the action, and attitudes of others and competing demands and preferences. Trans-theoretical model, or stages of change, theorizes that change occurs over time and in 6 distinct stages. Pre-contemplation, contemplation, preparation, action, maintenance, and termination. So pre-contemplation is where the individual is unaware of the need to change. Contemplation is where the individual considers change and weighs the benefits with costs. Preparation is where the individual plans to take action. Action is action. Maintenance is where the individual implements actions to continue the behavior. And termination is when conscious efforts to continue the health behavior are no longer needed because the individual is consistent. Most clients never reach this point. Precaution adoption process model. Similar to the trans-theoretical model and stages of change models. Includes a stage of being unengaged regarding an issue between the stages of being unaware and contemplating action. It does not include a termination stage. Essentials of community nursing. Determinants of health are client or environmental factors that influence the client's health. These can include nutrition, social support, stress, education, finances, transportation, and housing. For additional information, refer to Chapter 2, Social Detriments of Health. Health indicators, mortality rates, disease prevalence, levels of physical activity, BMI, tobacco, or other substance use. This describes the health status of a community and serves as a target for the improvement of a community's health. Nurses determine a community's health by examining the degree to which the community's collective health needs are identified and met. Community is a group of people and institutions that share geographic, civic, and/or social parameters. Communities vary in their characteristics and health needs. Community health nursing involves a synthesis of nursing and public health theory. The goals of community health nursing, also called community-oriented nursing, are to promote, preserve, and maintain the health of populations by the delivery of health services to the individuals, families, and groups in order to influence community health. Community health nurses are nurses who practice in the community. They usually have a facility from which they work, like a health clinic, county health department. But their practice is not limited to institutional settings. Care is often delivered in a setting that is part of the client's environment, like home, school, or workplace, but is focused on the community population and subpopulations. The community or a population, which is an aggregate who shares one or more personal characteristics within the community, is the client in community health nursing. Community-based nurses can develop relationships with clients while working directly with individuals who have acute and chronic conditions and their families. Public health nursing is a population-focused and involves a combination of nursing knowledge with social and public health sciences. The goal of public health nursing is promoting health and preventing disease. Public health provides 10 essential services, one of which is to conduct research to gain new knowledge and solutions to public health problems. The remainder fall under the 3 core functions of public health according to the CDC. Assessment, using systematic methods to monitor the health of a population. Monitor health status to identify community health problems. Diagnose and investigate health problems and health hazards in the community. Policy development, developing laws and practices to promote the health of a population based on scientific evidence. Inform, educate, and empower people about health issues. Mobilize community partnerships to identify and solve health problems. Develop policies and plans that support individual and community health efforts. Assurance, making sure adequate health care personnel and other services are accessible, especially to those who might not normally have them. Enforce laws and regulations that protect health and ensure safety. Link people to needed personal health services and ensure the provision of health care when otherwise unavailable. Ensure a competent public health and personal health care workforce. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. Population-focused nursing. Population-focused nursing includes assessing to determine needs, intervening to protect and promote health, and preventing disease within a specific population. Individuals at risk for hypertension, individuals who don't have health insurance, individuals who have specific knowledge deficit. The Public Health Intervention Wheel is a variety-used model for the 10 essential public health services and is available through the Minnesota Department of Health website and the CDC website. Community partnership occurs when community members, agencies, and business actively participate in the process of health promotion and disease prevention. The development of community partnership is critical to the accomplishment of health promotion and disease prevention strategies. Key principles of public health nursing. Emphasize primary prevention, work to achieve the greatest good for the largest number of individuals, and recognize that the client is a partner in health. Use resources wisely to promote the best outcomes. Principles guiding community health nursing. Factors to consider when providing community health nursing practice include the following: ethics, advocacy, evidence-based practice, quality, and professional collaboration and communication. So ethics is the Public Health Code of Ethics identifies the ethical practice of public health. Ethical considerations include preventing harm, doing no harm, promoting good, respecting both individual and community rights, respecting autonomy and diversity, and providing confidentiality, competency, trustworthiness, and advocacy. Community health nurses are concerned with protecting, promoting, preserving, and maintaining health, as well as preventing disease. These concerns reflect the ethical principle of promoting good and preventing harm. Balancing individual rights versus rights of community groups is a challenge. Community health nurses address the challenges of autonomy and providing ethical care. Client rights include the right to information disclosure, privacy, informed consent, information confidentiality, and participation in treatment decisions. As nurses participate in research in the community setting, it is important to use ethical decision-making to promote client rights. Public health nurses can apply ethical principles through core functions as they collect and manage information, develop policies that are in the best interest of the people in the area, and create interventions that promote healthcare quality across population groups. Advocacy. Client advocate is one role in the community health nurse. The nurse plays the role of informer, supporter, and mediator for the client. The following are basic to client advocacy. Clients are autonomous beings who have the right to make decisions affecting their own health and welfare. Clients have the right to expect a nurse-client relationship that is based on trust, collaboration, and shared respect related to health and considerate of their thoughts and feelings. Clients are responsible for their own health. It is the nurse's responsibility to advocate for resources or services that meet the client's health care needs. Advocating for client requires assertiveness, placing priority on the client's values, and willingness to progress through the chain of command for resolution. Nurses act as advocates for communities and populations through efforts to change healthcare systems and improve quality of life. An example of public health advocacy includes nurses working to promote access to clinics for individuals who live in rural communities. Evidence-based practice involves using best practices, expert opinion, and client preferences to change the delivery of client care. The goal is to improve client outcomes. Data. The nurse should appraise data collected from research to measure whether bias was minimal, which is quality, the number of studies, participants, or strengths of effect, which is quantity, and whether the results are repeatable, which is consistency. The nurse then analyzes the data for application to practice. Data is also classified to determine the strength of the information. The nurse should seek the highest level of evidence available and choose information that is validated by the systematic peer review. In the community, evidence-based practice improves public health as nurses develop policies to improve the health of specific groups. The public health nurse can use evidence to provide new solutions for groups of people, such as assessment, or this is an assessment, provide information to communities, policy development, and evaluate the effectiveness of the healthcare environment of groups. This is assurance. An example of evidence-based practice in community health includes the use of high levels of evidence to support media campaigns regarding immunization guidelines. The Community Preventative Service Task Force produces a guide that reviews health promotion and disease prevention guidelines compared to the available evidence. The task force then determines whether there is sufficient or strong evidence to implement an intervention and lists which ones have insufficient evidence to show that they are effective. The nurse must consider several factors when applying evidence to practice: cost, benefit to the client, client satisfaction, safety, and client-specific factors, such as culture and demographics. An intervention that is appropriate on the client or family level might not work when the nurse is caring for communities or populations of people. Nurses in the community setting can contribute to the body of evidence by implementing research studies in the practice setting and in a collaboration with educational institutions, healthcare facilities, and through community-based participatory research. This includes partners, professionals, and community residents in identifying health issues and intervening. The CBPR, or Community-Based Participatory Research approach, fosters support from community members, develops leadership within the community, and promotes a positive collaborative relationship with health professionals. Quality. Quality assurance, quality improvement, and quality management are part of improvement of healthcare. Detailed information about quality improvement is available in the Nursing Leadership and Management Review module. Quality care is promoted through licensure and credentialing of healthcare providers, adherence to facility policies, professional development, and compliance with legal guidelines. Specialty certification is available for many community health roles. Quality report cards for managed care and public health organizations provide data about the effectiveness of care. Community health report cards can include health profiles, needs assessments, information about quality of life, and health status. Nurses can use information from quality report cards in developing or revising strategies for care of communities. An example of increasing quality in community health is educating clients who have diabetes on how frequently their providers should perform glycosylated hemoglobin testing. Total quality management is an approach that seeks to improve quality and performance in which meets or exceeds expectations. Continuous quality improvement is an approach to quality management that emphasizes the organization and its processes and systems and uses objective data to analyze and improve processes. Public health nurses follow the continuous quality of improvement process in carrying out roles of assessment, assurance, and policy development on an ongoing basis. Nurses can evaluate quality by examining the following aspects of care: effectiveness, timeliness, client-centered, equity, safety, and efficiency. Effectiveness is providing services to those who will benefit. Timeliness is reducing waits and harmful delays in providing and receiving care. Client-centered is ensuring client values guide decision-making. Equity is providing equal care without discriminating against gender, race, sexual orientation, socioeconomic status. Safety is avoiding injuries to clients from the care intended to help them. And efficiency is avoiding waste in supplies, ideas, and energy. Professional collaboration and communication. Nurses in various community settings use communication skills in caring for individuals, collaborating in teams and groups, and interacting with other professionals and informing the public and stakeholders. The nurse facilitates communication with the client through transfers from one level of care to another across the continuum of care. Nurse leaders use professional communication in roles such as mentoring, coaching employees, managing conflict, and supervising programs. Community health nurses should take care to use clear language with a respectful tone when using written, electronic, or print correspondence. The nurse should incorporate knowledge about variations in verbal and nonverbal communication, literacy needs, and client preferences when interacting with clients and groups. As with all aspects of healthcare, the nurse in the community setting is bound by laws regulating privacy and confidentiality in all forms of communication. Benefits of professional communication: increased client adherence to prescribed treatment plan, reduced admissions to acute care, reduced cost of care, shared decision-making with client and family, and reduced medication errors. Health promotion and disease prevention. The terms health promotion and disease prevention are often used interchangeably. They refer to strategies which affect an individual's overall health, to promote good health, to reduce the overall risk for disease, and to reduce the risk for specific conditions such as motor vehicle injuries and influenza. National Health Goals guide nurses in developing health promotion and strategies to improve individual and community health. Community health nurses participate in 3 levels of prevention: primary, secondary, and tertiary. Health promotion. Healthy people national health goals are derived from scientific data and trends collected during the prior decade. These goals are based on those issues that are considered major risks to the health and wellness of the United States population. Healthy People was initiated in 1979 and every 10 years publishes the National Health Objective that serve as a guide for promoting health and preventing disease. Healthy People serves as a measure for quality of health. The National Health Goals guide the nurse in developing health promotion strategies to improve individual and community health. Healthy People objectives include impacting the following focus areas: access to health services, adolescent health, chronic kidney disease, disability, genomics, global health. The community health nurse actively helps people to change their lifestyles in order to move toward the state of optimal health. Preventative services include health education and counseling based on scientific evidence, immunizations, taking preventative medication, lifestyle changes, and other actions that aim to prevent a potential disease or disability. The community health nurse is often responsible for planning and implementing screening programs for at-risk populations. Successful screening programs provide accurate, reliable results, can be inexpensively and quickly administered to large groups, and produce few, if any, adverse effects. The nurse should evaluate a potential screening method to determine whether it can be used consistently, which is for reliability. It demonstrates accuracy of measurement, which is validity, and how effective it is at identifying an individual with a particular condition. This is predictive value. Disease prevention. Primary prevention. Prevention of the initial occurrence of disease or injury. Nutrition education. Family planning and sex education, smoking cessation and education, communicable disease prevention education, education about health and hygiene issues to specific groups like daycare workers, restaurant workers, Safety education, such as seatbelt use or helmet use, prenatal classes, providing immunizations, advocating for access to healthcare, healthy environments. Those are primary preventions. Secondary preventions, early detection and treatment of disease with the goal of limiting severity and adverse effects. Community assessments, disease surveillance, such as communicable diseases, screenings, cancer. This is breast, cervical, testicular, prostate, colorectal. Diabetes, hypertension, hypercholesterolemia, sensory impairments, tuberculosis, lead exposure, genetic disorders and metabolic deficiencies in newborns, and control of outbreaks of communicable diseases. These are secondary preventions. Tertiary prevention, reducing the limitations of disability and promoting rehabilitation following the health alterations. This is maximization of recovery after an injury or illness. This is rehabilitation. Nutrition counseling for management of Crohn's disease. Exercise rehabilitation. Case management for chronic illness or mental illness. Physical and occupational therapy. Support groups and exercise for a client who has hypertension, which is for an individual. This is tertiary prevention.